All right, welcome to 10. This is Tech Entrepreneurs Nebraska. I'm Shauna Dorsey with the Nebraska Tech Collaborative powered by Exarban, and I'm here with
Brian Poppy. I work at Mutual of Omaha. We're joined today by Ryan Cameron. Ryan, how are you?
I'm great. If I was any better, you'd have to clone me, which is about as good as it gets.
Huh.
Boy, that is a new...
That's
I might steal that one. I've never thought about it.
Feel free. Feel free. I got lots of them.
That's great. I like that.
Yeah.
I'm glad to hear you're doing great.
Yeah. It's a great time to be in Nebraska, and it's certainly a great time to be with Children's Nebraska. We've got so many exciting things going on with pediatric healthcare in our state and beyond. So it's awesome.
Yeah, that's
so great.
Great. That's where I was going too. It was like, tell us what you do, and then
sure.
Go ahead.
Yeah, I'd be happy to. So I'm Vice President of Technology and Innovation, which is a relatively new role for our organization. My background is not in healthcare. I actually come from startups and technology management. So bit of an investment, I think, on children's behalf, and a great one. I'm trying to help the organization be more innovative and entrepreneurial, and each and every day we get closer and closer to being a leader in that area.
Yes, that's awesome. One of my favorite stories, and I will not steal your thunder, I promise, but is of you getting healthcare professionals involved in this process. Can you talk to us about that?
Yeah. Today's episode is really good timing because we actually just finished up our first ever, we're calling it our inaugural Innovation Cup. And what we did with that, it's not new to lots of organizations, but it's new for us. And so we invited everybody on our team, regardless of the department that you work in, if you're a nurse, a provider, physician, whomever, to submit their best ideas to enhance not only patient care, but the experience of being an employee at Children's. And so we thought we'd have about 25 ideas when we went down this journey. We ended up with 125 ideas.
Oh, all right.
Yeah. And we'll be using that as a pipeline to kind of develop all the new innovations that are coming up the next year.
Yeah, that's cool. Anything that you can share, like of the 125?
Yeah.
Even if you're not going to do it, maybe like your personal favorite.
Sure. It would be impossible to do an NDA with our entire audience. Nebraska Nice will come into play here, I'm sure. You won't tell all of my secrets. But we're doing some really cool stuff with community outreach. One thing that's really important for Nebraska, of course, is not only healthcare in the cities, but also in throughout the state and rural environments too. And so if you have a child who has an acute condition or a chronic condition, getting to and from a clinic or a hospital can be something that's really challenging. So a lot of the innovations that you'll see coming out are going to be tied to connectivity, a hub and spoke model with Children's in the state.
Mm-hmm. That's amazing. And I love too that just asking employees, what do they think needs to be solved, what can be innovated on is so great. They're closest to the patient, to the experience.
Absolutely. My philosophy is the best ideas aren't going to come from myself or from my team. They're going to be the ones that walk in the door. Mm-hmm. And we certainly experience that. And, one piece of advice I would give anybody that's, trying to be more innovative in their organization is understand that there are $1 million ideas in your organization today. And all you have to do is just kind of go idea mining and look for those things. So often we see the same voices and have the same voices that are in meetings all the time. Mm-hmm. And if you're intentional about reaching out to people, my experience has certainly been that they're willing to kind of share what those great ideas are.
Yes, that's great.
Yeah, when I worked in innovation for a while, we tried to fight the HIPPOs, we called it, which is highest paid person's opinion.
Oh, sure. There can be some hippos out there for sure. We try to be a pretty flat organization. And, another thing that we've done is we've tried to kind of take the fear and intimidation out of disruptive technology. And I mean, if you're like me, you have AI fatigue right now, and you're kind of tired of hearing about, robots taking over the universe and all of those trendy things that are happening. And so we set up a network of, I'll call them meetups. We call them affinity groups internally. And everybody is invited, whether you're an expert or a novice or just have a passing interest in it. We meet once a month. We don't assign any new work to people. There's no homework. But we talk about how these things are going to impact healthcare, how it's going to impact our patients and our patient families, and what our plan is to respond.
That's so great. I just love it. I'm fascinated by Ryan Cameron always. Like I have been for years since you were at Creighton.
I was, yeah.
And can you like just talk to us about how you got into this entrepreneurship space and why it's so important to you? You love to, well, go ahead, you go.
Well, it's been a weird journey. I started out my career. I wanted to direct music videos. Like that was my dream. And
So
still
hold on
time.
a second. So you and Brian Poppy, he's a DJ.
I'm also
Brian.
into music too. This is fun.
way cool. We'll have to talk shop
Can't
one
wait.
day.
Yeah, I can't wait till my stint at Creighton and Children's. Like, just following your career arc.
So I started out down that pathway. I was working for Fox and for CBS and a couple of networks, and just working with computers all the time. Eventually, somebody puts you in charge of them. You just kind of follow where life takes you. The entrepreneurial thing really started at Creighton as a result of seeing very, very intelligent people not having a lot of opportunity to get above and beyond kind of that first mile of something that they wanted to work on. So there had to be a pathway where people could have exit velocity and really develop things on their own. And so we started a program there called the Idea Hub, and that really empowers students to take ideas and run with them. Everything from creating solar-powered virtual libraries to, you name it, new methodologies for doing 360-degree photographs and VR. All of that came out of Creighton from students that weren't necessarily majoring in that. Mm-hmm. So we would see like dance majors and theology majors that had innovative ideas that needed a place to go. And at Children's, it's really no different. Mm-hmm. We see physicians now that are going back to school to get informatics degrees. And we see nurses that are coming in that, have really strong interest in software programming and those sorts of things, because data and technology is really essential to healthcare. Yeah. And so those two things put together, you really have to have a pathway to move forward, particularly in peds. Pediatrics is really underserved. So about 2% of startups that are focused on healthcare focus on pediatrics. And that's a shockingly low number when you bolt onto that. Over 22% of the patient population falls under the care of pediatrics. Mm-hmm. So it's a huge gap. And so we are really kind of left to our own to bootstrap a lot of these innovations on ourselves.
Boy, and I mean, honestly, like you've got an audience that feels like would be super receptive to being like
we're
the
lucky.
Test subjects for innovative ideas, right? Mm-hmm. Like,
yeah, we're really lucky. Nebraska is just an incredible community to live in. We have great philanthropy here, great support, and a lot of people that really strive to be the best. Mm-hmm. And so that's what's so energizing about being at an organization like Children's is if you just create a little bit of opportunity, the team really just rises to the top and they just run with things. So it's great.
So one of the things we like to ask guests that have been kind of in the entrepreneurial ecosystem for a while is like, what is Nebraska missing?
Oh boy. Okay. I don't know if we're really missing something. I think we just need more people and more involvement. Mm-hmm. Over the last 5 years, I've kind of watched this ecosystem come together, and more so than ever has the resistance to entry to starting a business. It's low. Mm-hmm. So if you've got a good idea, you can run at it right now. There's state grants, there's federal grants, there's accelerators, there's venture capital, there's meetups, there's groups. There's so much here. I think it's just really a matter of engaging a bigger group of more diverse people to take those ideas forward and just encourage them and let them know the great resources that we have.
Right. And that there's a place for them, because I think that's one of the challenges too, where people are like, oh, I don't really belong at a 1 million cups, for example. And it's like, absolutely you do. Mm-hmm. And like you mentioned, from the novice to the expert, even if you're just curious about startups.
Yeah.
Those events.
You don't have to know how to code.
Yep.
You don't have to know how to write a business plan. You don't have to have a pitch deck. You don't have to, come from Elon Musk's, giant war chest of money. You can start at ground zero and create your own business, create your own idea, and just run with it here. And it's kind of shocking that the path to entry is so low.
Mm-hmm. Yeah, it feels like we've got all the pieces.
Yeah. Yeah, if you were on the coast, boy, it would be a totally different fight.
Yeah.
Here, you don't have to fight. Here, you're supported to do it.
That's right.
Well,
So
Ryan,
good.
thanks for joining us. We did hit the end of our 10 minutes.
Yeah.
So
Great. My pleasure.
So great. Thank you for being here.
Anytime. Hope to come back.
Awesome.
thanks, everyone.
Thank you.